Universal health coverage. Does long-term providing universal health coverage. Access to access to defined essential range of medicines. Universal assured. Every individual assured access to medicines and treatment at an affordable price. Chhatra Yuva students all over the world who contest MP, MLA, Jila Parishad, Sarpanch, Ward member, minimum councillors. This seats only 50 rupees nominations apply. Without study, preparation for government job. This is the 20 lakh jobs in India every 1 to 3 years. So you apply. Every countries, America, Iran, Russia, every हर देश में तुम 50 रुपये में नॉमिनेशन करो चुनाव लड़ो हर स्टूडेंट एवरी स्टूडेंट्स available health care service is quantitatively inadequate due to massive shortage of healthcare professionals. Ineffective because of shortage of healthcare officials. Availability of healthcare services quantitatively inadequate. Massive shortage. Public health system face many difficulties. Would have access to define essential range of medicines. Which should be entirely free for a large percentage of the population. Which should be entirely free voucher for large percentage of the population who are below poverty lines with pills. Not only in paper, document, really. Availability of healthcare services is quantitatively inadequate due to massive shortage healthcare professionals. Availability of healthcare services quantitatively inadequate due to massive shortage healthcare professionals. And the public is spending insufficient funding of public facilities combined with faulty planning that has been yielding poor health outcomes. Yielding poor health outcomes in the public facilities combined with the faulty planning. It is believed by many policy makers that private healthcare properly subsidized. Private healthcare properly subsidized or private health insurance subsidized by the state can meet the challenge in most of the country's mix of private and public service at reality. Private sector could definitely come into health coverage. Private healthcare properly subsidized in most of the countries. A mix of private and public services is reality. Private sector could definitely come in to supplement the efforts of public sector to deliver universal health coverage. Insufficient funding of public facilities combined with faulty planning and inefficient management, faulty planning, public funding, insufficient funding for public facilities over the years has resulted in dysfunctional health systems. Dysfunctional that has been yielding for health outcomes, poor health outcomes. Public systems. Public system. Public system may take the service of a willing private provider. India, in India, public system healthcare is not up, affordable in private medicals. They are not access to the public global universal health coverage. Public system may take service of willing private providers. May take the service to fill gaps in capacity to deliver all the services assured under the USC. Willing private providers to fill gaps in its capacity. Such private provider will have to deliver a cashless service and would be compensated on basis of a predetermined cost. or package of health service. In addition to partnering with the private sector, other viable alternatives should also be considered. India could possibly learn from international best practices. India could possibly learn from international best practices in countries like Canada and Australia. Canada and Australia, where universal health coverage is already operational, universal public insurance program is publicly financed through tax revenue. Public insurance program is publicly financed. In Germany, statutory health insurance is funded by sickness funds. It is now widely accepted that the private sector could help in realization of goals. Private sector could help in realization of a goal of universal health coverage. There is no alternative to progressive strengthening of the public facilities. Beginning could be made by the increasing public expenditure on health from current level to 1.2% to at least 2.5% of the GDP. By the end of a 12th 5-year plans, a national health package should be developed that offers essential health service at different levels of healthcare delivery systems. Actually, India could possibly learn from international best practices in a country like Canada. Universal coverage is already operational. Universal public insurance program is publicly financed. Universal public insurance is publicly financed through tax revenue. In Germany, statutory health insurance is funded by sickness fund. It is now widely accepted that enough private sector could help in realization of goals of universal health coverage. There is no alternative to progressive strengthening of the public facilities. Beginning could be made by the increasing public now widely accepted that the private sector could help in realization goal of universal health coverage. There is no alternative to a progressive strengthening of public facilities. Beginning could be made by the increasing public expenditure on health from current level. The GDP by the end of a 12th February plan, a national health package should be developed that the offers essentials health service at different levels of the healthcare delivery system. Beginning could be made by the increasing public expenditure on health from current level 1.2% to at least 2.5% of the GDP. At the end of a 5-year plan, a national health package should be developed. Health package that offers essential health service at different levels of healthcare delivery systems. Healthcare delivery systems. Universal healthcare systems. Package should be developed that offers essential health service and different levels of healthcare delivery system. Actually, though there have been several different estimates, improvements to make internationally competitive. Enter foreign education institution. Education institution would help improve the quality of higher technical education in country. Higher education scenario in India lacks of age up to match up to global competitiveness. Match lacks the age above up to global competitiveness. When we compare global rankings, Indian universities fare rather poorly. The problem is that higher education in India face primarily low quality of teaching and learning. The greatest challenge that higher education in India faces is a chronic shortage of faculty. According to report, around 30 to 40% of faculty positions are lying vacant. 40% lying vacant.